I did a little research on this before we got on because I knew that was the focus of your group to a great degree. And not surprising to me, but it's all sitting there in the literature because what did I say at the outset? I said at the outset, increased oxidative stress increases, aggravates, or causes, to one degree or another, all diseases, because all diseases have the final common denominator of increased oxidative stress secondary to toxin exposure. And in 2017, we have an article in one of the obstetric gynecology journals that clearly show periodontal health, periodontal being the gums, okay? And I show in the book that anything that correlates with periodontal disease or infection is going to correlate even more with an infected tooth because it's the same spectrum of pathogens, but in a much higher concentration and a much more efficient delivery system when they're in the tooth. So, I mean, when you have an infected tooth and you chew on it, what do? I mean, you express toxins and pathogens directly into the venous system and the lymphatic system better than if you do it IV with a syringe. Mm-hmm. So one of the things to remember is, unfortunately, for whatever reason, infected teeth not only have an intense array of pathogens, but you also have the optimal delivery system to get them throughout your body. So anything, point being is anything that says it correlates with periodontal or gum disease is going to be even more strongly correlated with these infected teeth. And we can see that fertility, including IVF, and also, interestingly too, it works on both sides of the equation. The periodontal disease or oral infections negatively impact the woman trying to become pregnant, and it also, the periodontal disease in men affects their fertility sperm-wise. So you really hit it from both sides and both sexes. Because again, it's might sound like an oversimplification, but I challenge anybody anywhere to show me data of a disease that's not either primarily caused by or severely promoted by any condition that increases oxidative stress throughout the body. And remember, oxidative stress equals inflammation. Those two words are really the same thing. So anytime you hear about something that increases inflammation, that means it's increasing oxidative stress. Same thing. Synonyms meaning the same thing.
There was a study and it linked periodontal disease with, it associated it with more IVF failures, and IVF success rates on average are about 26.6%. So I would urge anyone who is going to go ahead with that procedure, to read the book, and then you're going to want to go through the diagnostic tools that Dr. Levy recommends, because if you have a silent hidden infection, it's just going to make everything more difficult for you as far as conceiving, like male factor, female factor.
And there's a couple of other papers I ran across, and I'm sure this is a familiar term to you and your group, is periodontal disease, periodontitis, gum infection, has also been directly shown to impact negatively time to conception. Mm-hmm. Okay, so obviously anybody looking to get pregnant wants to do it in 6 months and not 6 years.
Mm-hmm. Yeah, absolutely. Periodontal pockets have shown to lead to decreased sperm motility and increased risk of male fertility, because sperm is 50% of the equation, and we see sperm quality as a whole has decreased tremendously over the last 20 years, and shockingly so. But
shockingly so. But remember, I mean, and this is one of the saddest commentaries at all. Forget about, for the moment, the mouth, and understand that the number of toxins that you encounter on a daily basis are astronomically higher now than they were in 1950, or they were in 1930, or they were in 1920. I mean, we are being assaulted, air, food, water, mouth. And it seems like they're just increasing in number astronomically every day. So unless you can completely live on a sterile planet, maybe Mars or something like that, you got to really protect yourself with antioxidants and stop or limit or thwart the toxins over which you have control. In this case, the mouth. If you diagnose it correctly, you do have control. You know, you don't really have control all the time over what you inhale, or if you have to go out in the public, there can be toxin exposures you can't protect yourself against. But you have to protect yourself against the toxins over which you have control.